Doctors are there to help, but that doesn't stop patients from lying to them. Some lie out of shame, and some, like the twisted story about two ladies claiming a man died of a heart attack, have far more sinister motives. The moral of the story: don't lie to your doctor. My friend, who is an emergency medical technician, once shared an intriguing story about a call she answered. She told me that the call was from a man who barely made sense because of his extreme distress, yet he was able to perfectly relay two pieces of information. All he could share was his home address and the word stomach. When they arrived, they found the man covered in a blanket, sweating excessively. His inactivity made it seem like he hadn't moved in ages. She quickly realized that as jaundiced as he looked, his cheeks were still flush with color. He was also avoiding eye contact, refusing to answer their questions. His sole verbal responses, punctuated by bouts of discomfort, were poison and stomach. Doing a quick sweep of the scene for any obvious signs of toxic substances, she found nothing. But just as she was about to return to the ambulance, something caught her eye. There was a large pot simmering on the stove. When she took off the lid, she was stunned, speechless. It was filled with a slew of decapitated Barbie dolls. The moment she informed the man about turning the stove off, he became unpredictable and confrontational until they safely delivered him to the emergency room. Coincidentally, later that same day, she encountered a buddy who worked in the radiology department. According to her friend, the man spent his entire time there repeating the word poison whenever they asked what he consumed. His attitude drastically improved, however, once they informed him that an X-ray was being planned. Later, they would realize why. A newfound serenity washed over him, and he started being more responsive, as though he'd accepted the inevitable confirmation of his actions. The X-ray showed that he'd swallowed at least 18 Barbie doll heads, which had been lodged in his stomach for 2 weeks. Why? His simple yet strange explanation was that he used to sterilize and swallow the doll heads because he liked how it felt when they left his system. Back when I was studying medicine, I had one patient I'll never forget. That day, my task was conducting a pre-surgery check on an elderly man, 80 years old. He was slated for an operation. It was around 8:15 in the morning when I saw him. My initial set of questions dealt with his medical background, his past illnesses, any prior operations, his current medication regimen, and whether he had any allergies. I also inquired about any past history of alcohol or cigarette use, a standard part of our routine. Given the noticeable yellow stains on his fingers, his pallid complexion, and his face's peculiar sallow hue, I was fairly certain the man was a smoker. So when he responded no to the smoking question, I was taken aback. Wanting to confirm, I asked him a follow-up question: "Have you ever smoked?" His answer was simple: yes. Following that, I queried about when he'd given up smoking. His answer made me burst out loud. He said, "I gave up smoking this morning." My ex-husband is an obstetrician. One night, just as he was about to head home, a woman burst into the clinic. It was almost 1 a.m. on a chilling winter's night. Alone and in labor, she was clearly in a lot of pain. It struck him as odd that she was completely solo. That's a rare sight for a woman in labor, especially in our small, close-knit town in Egypt. In between contractions, she quickly relayed her details, including info about the father, assuring the doctor that he was en route from a different city. There wasn't time for more questions. The baby was imminent, capturing all the doctor's attention. Post-delivery, she was left to rest in her room with a night nurse looking after her. Before leaving, the doctor checked in on her and the newborn boy. Once home, he told me not to disturb him unless the nurse called in. At 4 a.m., the phone rang. It was the nurse, sounding rather flustered. Judging by her tone and his responses, I speculated something had gone terribly wrong with the patient or the baby. The truth was even stranger. The new mom had fled the clinic. Neither the nurse nor the cleaner could stop or track her. And what's worse, she lied about her name and the baby's father's name. I was super worried for the child, but my ex said the nurse could handle it. The next day, he went to the clinic and worked a full day. When he came home, he had unbelievable news. The woman was still gone, but he'd met a man at the station, a shop owner in the vicinity of the clinic, who happened to hear what had unfolded. He and his wife, who'd been trying to have a baby for 20 years, had frequented the clinic several times. Hearing their plight, the man asked if he could adopt the abandoned baby. It took a lot of paperwork, but they eventually brought their new son home a few months later. Once a month, A friendly woman in her 30s who used a wheelchair would come see me for a refill of her pain medications. Having taken over her case from a previous colleague, I didn't know the full details of her pain situation. That would come back to haunt me. She was always warm to me, especially spending a few minutes sharing tales about her 2 young boys ages 6 and 8. She was diagnosed with chronic back pain and anxiety, and typically I'd prescribe Percocet and Xanax for her every month. Sadly, I never dug deep into her medical history. That was my failing. I just went on prescribing, uncritically following her previous doctor's plan. One fateful Monday, a coworker flagged me and pulling out her iPhone revealed a series of photos. There was my patient at a nightclub, no wheelchair in sight, vibing with her friends in high heels and tearing up the dance floor. I felt blindsided and admittedly amused. I genuinely enjoyed our friendly chats and was dreading the inevitable confrontation. When she came in for her next refill, I knew I had to say something. Deciding on simplicity, I asked her if she enjoyed dancing. From her wheelchair, she looked at me like I'd lost it. Dance? How on earth would I dance in this wheelchair? Maintaining a calm gaze, I smiled and stayed silent a moment before asking from a different angle, "So, when was the last time you hit the dance floor?" Caught off guard, she laughed nervously, but I was in for a surprise. She soon broke down crying. I assured her it's all right, but I'm afraid I can't keep prescribing these medications. We're going to gradually and safely wean you off them. Despite a few minutes of protests and pleading for her refills, I had to insist on her transitioning away from the meds. I was just finishing my late-night lunch when a 16-year-old girl was quickly brought into the hospital. She was in extreme stomach pain that hadn't stopped for a while. The girl was an absolute wreck. She was shouting, crying, and praying to every saint she could think of. She rated her pain at 12 out of 10, and it came on quickly. She had even wet herself, so we got her changed into a hospital gown. My checkup revealed that she felt pain in her lower abdomen, which was constricting strangely. I asked her about allergies. Nothing. I asked about what she'd eaten or drunk earlier. Also nothing. That's when I thought to ask a serious question. I said, "Might you be pregnant?" Both the girl and her parents dismissed the idea. They mentioned that her periods could be irregular and she promised she wasn't pregnant. Still, something didn't add up. At first, I only administered acetaminophen through an IV. Despite her pleading for a stronger painkiller, I held off. I started her on IV fluids and ordered a blood test along with a pregnancy test. The parents strongly refuted any possibility of a pregnancy, but I explained that it was important to rule things out. The mom wasn't keen on the test, but the dad understood. The assays were rushed, and when I got the results, it all made sense. On my way to share the information, a scream from behind the privacy curtain stopped me. We hurried over to find out what was happening. The girl was on her back, head bent forward, legs spread wide, completely bare, and she was pushing. Then it clicked. The tightening stomach, the wetting herself, the slight sound of doubt in her voice. Not only was she pregnant, she was already giving birth. And just then, a baby's head appeared between her legs. Everything sped up. I grabbed sterile gloves and a newborn resuscitation kit as my nurse called the pediatrician and obstetrician on call. I helped the girl through the labor, let her hold the newborn for warmth and bonding, and luckily the specialists arrived shortly to evaluate both the girl and the baby. Later, the truth came out. She'd had a secret boyfriend at school. Thankfully, mom and dad accepted their unexpected grandchild. The last I heard, the young couple had gotten married and had a second child. One night, I was interning at the emergency room. A man with back pain came in. He couldn't explain how he got the pain and didn't want further examination. He was just looking for some pain relief medicine. My colleague told me an important detail. The man often came at the start of the month when new interns like me would be working, hoping to persuade us into giving him particular medications. My colleague recommended that I provide the man with some fake medications to take home, so I came up with a plan. I gave him a gentle over-the-counter painkiller along with a packet of 4 placebo pills. I instructed him to only take these once he was safely at home and in bed, and to limit himself to 1 every 6 hours, given their apparent strength. He was clearly unsatisfied and asked suspiciously, "What are these?" I quickly made up a name calling them Gronkagon. His reaction was incredible. He immediately refused, shaking his head, saying he couldn't use them. When I asked him why, he replied, "I'm allergic to Gronkagon." I used to work with kids as a dental assistant with expanded duties. I once had a 4-year-old patient with incredibly bad teeth. Even his tongue didn't look normal. I knew something was wrong. His mom insisted that he always brushed his teeth and didn't eat sugary food. To be frank, that didn't add up with what I saw, an immense buildup of plaque. While his mom was taking a call, I escorted him for his x-rays. I asked him about his favorite foods, and he instantly mentioned chocolate, candy bars, and soda. Diving deeper, I found out he drank soda from his baby bottle daily, a habit that should have been abandoned years ago. Also, access to candy and chocolate was abundant, but it gets worse. When I asked him about brushing his teeth, he told me that he didn't know how. His mom apparently told him he didn't need to, but his dad emphasized it. Looking at his x-rays, it was heartbreaking. Cavities were present in all of his teeth, and likely future decay in his permanent ones. Back at the chair, I started cleaning his teeth and began explaining why good dental hygiene is essential. His mom wasn't receptive to the discussion and seemed perturbed when I revealed her son's frequent sugar intake and brushing habits. Her reaction was infuriating. She countered, saying his baby teeth would fall out anyway. During this time, his father arrived. After explaining the situation, he was furious but restrained, threatening to drag her to court for neglect. She tried to excuse her behavior, but he wasn't buying it. Through all of this, I continued cleaning his teeth, removing layers of plaque. It was heartbreaking to see such neglect affecting this cheerful boy's dental health. His mom stormed out, and the boy left with his dad for the weekend. We devised a treatment plan involving pulling and filling several teeth, along with diet recommendations, but the story doesn't end there. 4 weeks later, when they returned for the extraction procedure, the boy proudly announced he lived permanently with his dad now, who had taught him a lot about hygiene. What happened next has always stayed with me. Over the next year, this once sickly child blossomed. He gained weight, improved his hygiene, and improved his vocabulary. We managed to stabilize his teeth health, and the potential damage to his permanent teeth seemed less severe. On his final appointment before I relocated, his teeth had no new cavities, and he was so proud. This guy came in with a dislocated shoulder. It was clear as day on the x-ray, and a simple physical check also confirmed it. His chart showed that it was his second visit to the emergency room that week for the same issue. Once a shoulder had been dislocated, it tends to be unstable, making it more likely to dislocate again, even with negligible stress. His story got a bit odd though. He claimed his shoulder dislocated a second time when he removed his sling to pour a bowl of cereal. The movement of lifting the half-gallon of milk seemed to be the problem. He appeared to be in severe pain. Our only option was to get the shoulder back in place. This can be achieved in several ways. For the most effective methods, sedation is a necessity. We hooked him up to a monitor and had a nurse, a medical technician, and even a medical student on deck to assist or learn from the procedure if it proved to be challenging. The amount of pain medication needed to sedate him was almost double than what we usually require. But it gets even weirder. Even after that, he was crying out in pain as soon as we began pulling his arm, so we gave him more medication. Once he was sufficiently sedated, putting his shoulder back into place was a breeze. Post-production, we wrapped his shoulder in a sling. Then we confirmed with X-ray that everything was aligned correctly and then sent him back to his recovery space while we arranged a follow-up with an orthopedic surgeon. When I went to talk with him about the follow-up and his upcoming consultation with the surgeon, he was screaming in pain. He claimed his shoulder had dislocated again on its own. An X-ray verified his claim, and we found ourselves repeating the entire process. This time he was discharged, but he soon returned, this time stating his shoulder dislocated while trying to get into his car. We had to prepare to redo the whole process, but then an emergency room technician came forward with the bizarre truth. She revealed that she saw the patient dislocate his shoulder voluntarily after stepping out for a cigarette break. When confronted, the patient initially denied, but ultimately confessed he could dislocate his shoulder himself and had been doing so intentionally to get long-acting sedatives instead of the short-acting propofol we were using. This is extremely hazardous. Emergency room sedation is not ideal. It involves risks including choking, circulatory collapse, and blocked airways. And as we know, any untruths a patient tells their doctor can be dangerous, but this kind of lie is like playing Russian roulette. One day, while I was on duty in labor and delivery, a woman came in and turned out to be my patient. As I was responsible for unplanned appointments, she was assigned to me after bragging about her prenatal care from another state. She raised a red flag. Though she said she couldn't feel her baby moving, she claimed her due date was supposedly a week overdue. She was adamant that we had to induce labor. I felt like I couldn't trust her, so I decided to order an ultrasound. During the ultrasound, what I found was absolutely shocking. The baby was tiny, much smaller than expected for a baby at full term, and also active. Usually, this situation indicates a lack of oxygen and stunted growth in a full-term baby, which would normally suggest the baby should be delivered. However, this woman's explanation was puzzling. She was vague about where she received prenatal care, something we needed to know so we could review her medical records. We decided to make a wild guess and called a large local hospital. Apparently, she had been showing up there every day with various words like contractions, bleeding, or lessened fetal movement, all without concrete proof. Exhausted from her pregnancy, she'd been pleading for a premature birth for weeks. The truth was even more disturbing. It turns out she was only 32 weeks pregnant. Each time she asked to deliver, the other hospital would tactfully remind her about the health risks a premature birth could pose to her baby. Frustrated, she thought she might have better luck fooling a different hospital that she was at full term. When we challenged her, she reacted with anger and indignation. The consequences could have been disastrous. Her deception could have jeopardized the baby's health. Had we fallen for her lie, the infant would likely have faced an extended hospital stay with incessant blood draws, IVs, oxygen support, and possible lifelong health challenges, even risking death. It was such a dangerous lie, and I still don't know the reasoning behind it. A few weeks before I was set to start my active duty as a second lieutenant at my branch school, I got hit on my left side by a troublemaker wielding a heavy tool. I guessed myself that I might have cracked a rib or two, but didn't get treated. Big mistake. Well, right before I was supposed to report for duty, a severe snowstorm hit. Due to an unfortunate slip and fall on the ice, I soon realized that physical training was simply not manageable. Thus, I asked for a medical checkup. The medic confirmed my suspicion. I did indeed have broken ribs. She advised me to take a few over-the-counter painkillers and to return in 3 days. As I was leaving, I asked her, "Could I assume that I'm on late duties until I see you again, Doc?" She said yes, but then asked me to confirm when I'd fallen. I informed her that it happened the previous day on my way to physical training. It seemed like I was shut down almost instantaneously. "Based on how quickly you're recovering, you should be up and at 'em by tomorrow afternoon," she declared. She thought my half-healed broken ribs were from the fall on ice, so yeah, my words came back to haunt me. Although I managed to avoid a lung puncture, the pain was wild. My time in uniform included 2 weeks of the most agonizing physical training ever. I'm a nurse, and I work in a pediatric department. I just dealt with the most irritating patients. It was such a needless hassle to straighten out. I was managing patients and headed for the crowded waiting room to call the next family using their surname. A mom, dad, and their little girl stood up and followed me back. I led them to a room, checked their vitals, verified the reason for their visit, tweaked a few things in their medical record, and updated their pharmacy and allergy information. I then informed the pediatrician they were prepared for their appointment. However, barely a few minutes after the pediatrician entered the room, they came back out saying, "This isn't my patient. Who is this?" I was so confused. I went back to question the parents. That's when I made a disturbing realization. They were indeed not the scheduled patient. Confused, I asked why they claimed to be someone else. Their response was simply that they got tired of waiting, so they decided to come in. The mishap meant we had to reverse all changes made to the patient's file and consult our attorneys to ensure no regulations were violated. It still stuns me how people can believe that something like this would go unnoticed. Like, how did they think it would work out? One day, while working in an emergency department, I encountered a young 18-year-old girl brought in by her mother who was suffering from recurring abdominal pain. Things quickly got tense. Her mother began to loudly insist that her daughter was pregnant. The girl vehemently denied this. I decided to ask the mom to leave, which she did, giving her daughter a stern look on her way out. I resumed our conversation and questioned her about birth control. She said she was on the pill. When I inquired about her menstrual cycle, she said she'd been having regular periods. Her vital signs were all within the normal range, except her heartbeat was a bit fast. Even though she didn't look pregnant, in her loose top, something about her story was making me slightly suspicious. Regardless, it was clear she needed help, so I escorted her to a private room and went to share my observations with a colleague. After that, my colleague went to check on the girl. A little while later, my colleague appeared at the emergency department door, looking absolutely stunned. "She just had a baby," she whispered in disbelief. I was taken aback for a moment, then blurted out, "So I guess we can forget about the pregnancy test now." After all the commotion, the midwives took the girl and her newborn to the maternity ward. In my intern days, I once had to admit a woman to the hospital. During our initial conversation, she shared her incredible story. She told me that she worked as a nurse in World War II and had been a prisoner of war in a Japanese camp located in the Philippines. She narrated a thrilling experience of almost getting halved by a machine gun while trying to escape, and she spent nearly a year in the hospital healing from that incident. It was amazing, she told me, that she was still living. Soon after, as I got ready to conduct her physical examination, she changed into her hospital gown with me out of the room. But when I returned, something didn't add up. I saw no signs of scars, and there were no traces of any bullet or surgical wounds when I listened to her lungs. Well, the truth came out eventually. She was suffering from schizophrenia and had fabricated the entire tale. Her mental health history was quite extensive, it turned out, and for a brief moment, I'd actually believed her story. A while back, I was taking pictures of the back of a diabetic patient's eyes in a clinic. I had this dear lady in her 70s. She had really badly damaged vessels at the back of her eye, to the point where I couldn't get a clear view, but she insisted her eyes were fine. Per protocol, I tried my best to get a good photo. Usually, this requires the patient to fix their gaze on a pointer, which allows us to guide the eye. Unfortunately, due to her severe condition, she struggled to focus on one thing, but her reaction was even worse. Despite this, she insisted, "There's nothing wrong with my sight, young man, and I'm staring straight at your pointer." I gently proceeded, giving it my best shot. I then walked her to the door and down some steps. The antics continued. She complained that the steps were unstable. Of course, it was the steps. It wasn't because she had vision problems. Her daughter, who waited at the bottom of the steps, slightly to our right, chimed in. "Hi, Mom, the car's over here." She motioned further to our right with one arm, extending the other to guide her mom. What happened next was unforgettable. The mother replied, "Thanks, sweetheart," and she promptly strode off straight to the left toward a rather taken aback man waiting his turn at the clinic. In the first year of my internship, we had a patient who complained about an intense pain on the right side of his lower back and had a history of kidney stones. He insisted the only remedy that helped was 2 milligrams of IV Dilaudid stat. Of course, it's weird for a patient to be that specific. He claimed an allergy to all other pain medications but was confident that 2 milligrams of IV Dilaudid stat would ease his pain. I wasn't buying it. So we requested a urine sample from him and took an abdominal x-ray. The returned sample contained a significant amount of blood, implying the presence of a kidney stone. After examining the x-ray on the light box along my fellow interns, we identified a large, sharp kidney stone. The size of the stone stumped us. We couldn't fathom how such a big stone could travel through the ureter, kidney tube, and it seemed unusually close to the surface. The patient was growing more frustrated by the minute, demanding his 2 milligrams of IV Dilaudid stat. A senior nurse passed by at this moment, assessed the x-ray, and glanced at the patient. Then she exposed his little scam. She lifted the back of the patient's gown, revealing a piece of white chalk secured to his back with Scotch tape. She also squeezed each of his fingers until she discovered a tiny hole through which he had added blood to his urine sample. He was a lot less pushy about his medication after that. In fact, he took off running out of the emergency room. During my time as a paramedic, I once responded to a call about a young boy who supposedly got hurt in a bicycle incident, specifically hurting his lower leg. However, as I evaluated the injury, it didn't seem to line up with the story of a typical bike accident. I decided it might be best to speak to the child privately, so I asked his parents to step away for a few minutes. I reassured the young boy, who was around 5 to 6 years old, that he wouldn't get into trouble for telling me the truth about what happened. With his reassurance, he finally told me the bizarre truth. He admitted that he and a friend had been trying to smash bullets with a hammer on a rock. That's when we discovered that, in fact, he had a bullet lodged in his leg. My ex worked as an emergency room doctor. He attended to a young woman one night who was suffering from an unusual yeast infection. He started off with the usual questions. Are you active? She said yes. He said, do you use protection? Again, yes. He asked what type. Her reply was a diaphragm. He asked, do you use jelly with the diaphragm? She confirmed she did. Everything seemed all right, so he prescribed her an antifungal medication and she headed home. But the story doesn't end there. Fast forward to the next week and she was back again. The yeast infection had worsened. The woman reiterated that she'd only used a diaphragm with jelly. In response, my ex gave her a stronger dose of antifungal medication, but this time asked her to bring the diaphragm if the issue persisted. Here's the twist. The following week, the young woman returns with a purple diaphragm. Why was it purple, you ask? You see, she had been using grape jelly instead of contraceptive jelly. She thought it would not only protect her, but also leave a pleasant smell and taste. One day, a worried mom came in with her daughter who was maybe 9 or 10 years old. She was worried because her little girl had a really bad runny nose. The doctor checked out her nose and then shared with me that she believed something was lodged deep inside the kid's nostrils. The doctor turned to the child and asked, "Did you put something in your nose?" In response, the little girl said, in a really mature and polite way, "Oh no, I'd never do that." Her answer seemed so practical and polished, I knew something was off. The pediatrician was not convinced, so again he asked her, "Are you absolutely sure nothing is stuck in your nose?" "Yes, I am positive," the little girl assured. The doctor observed her for a moment, then after an oddly silent break, the young patient confessed. She said, "Well, sometimes I play with gravel." She kept her gaze fixed on the floor. Luckily, the pediatrician shares the building with a nose, throat, ear specialist. She popped into the next office and asked him if he could use his nose equipment to check the child's nose. He agreed and quickly brought over a special instrument and tweezers. He examined her and made a disturbing discovery. "Yeah, there's definitely something in there." He then proceeded to put out a snot-covered piece of gravel. Once the small rock was out, the little girl appeared a bit embarrassed, but she continuously denied sticking it there till the very end. If you ask me, she's probably got a bright future ahead, maybe even in politics. My dad is a doctor. One day, he was called to the house of a man who had a heart attack and passed away. It was supposed to be just another day on the job for my dad, but then he walked through the door and his day got a whole lot more complicated. 2 ladies were hovering over the man in the front entranceway of this palatial mansion, which was clearly his. He immediately knew something was off. Though the ladies kept saying the same line about a heart attack, the man was lying face down. So he decided to turn him over and check. To his shock, he discovered an unusual wound on the man's chest. As it happened, the women had schemes to take out the older man for his money. This happened in a retirement hub where the deaths of older folks often weren't investigated. If it had been my dad's co-workers, they might not have examined the man as thoroughly or even undid his shirt. If not for my dad, chances were high that the women would have successfully gotten away with it. If you liked this video, please like and subscribe to our channel.